Again, thank you all for joining. Thank you, Professor Ochs, for joining. We're going to be talking about the population health textbook during this session. Specifically, I'll just give a brief overview of the program. I know many of you, as we're seeing, have heard this before. You could probably actually, you know what? I'll stop talking. Nikki, Carrie, go ahead. You can give it. Just kidding. Um, uh, as Lindsay just put in the chat, we'll provide the session recordings afterwards for you to get to and then share, hopefully, and any other information. Typically we have been getting through all the questions and comments during the session. If there's any we don't get to, if we start to run out of time, we'll follow up on anything we don't get to here. But the way we'll kind of structure this is I'm just going to give a little bit of an overview of the session and the program itself, and then Jessica will share, and then we'll do Q&A at the end. We'll monitor the chat the whole time if there's any in the Q&A. If you have general comments, things like that, go ahead and put them in the chat if you don't mind. And if you have direct questions you would like us to address, this goes for questions directly to the author or to OpenStax or anybody else, go ahead and put them in the Q&A, and we'll make sure we get to those. And then if you need captions, you should click that. Should be a caption button at the bottom of your screen, so show captions or just captions. If you don't see it, click the more button that should be on the right hand side of your Zoom environment, and you should see captions listed under there. So to kind of just start us off, I'll say that, thanks, Lindsay. I'll say that this summit this is the one summit, and we're towards the end of our second day. It's been a great conference, so much engagement throughout. We're so happy to have you all here. This summit and the One Project itself is a partnership between the THCCB, Texas Higher Education Coordinating Board, and OpenStax, and we're working on a series after a lot of work in collaboration with faculty and nursing administrators and advisors and experts from all over the country and all different types of nursing education. We started on this project to develop these 8 nursing textbooks that will be available freely and openly for you to use, for you to give to your students with no barriers to access in multiple formats, online, PDF. You can do it through your LMS. We'll give it to you in Word documents. You can use just the images. You can use just one chapter, whatever you want. We'd love you to use the whole thing. But and then that can be integrated with other resources from other sources, such as OpenRN, and especially related to this session, probably the social determinants of health workbook that Carla and Dawn presented earlier today, and we're so glad that they were participating. It's great. It's just the beauty of OER, everybody working together to contribute these resources. As we think of them as OER and we think of this as a series, the books are developed to fit their course. Not to speak for Jessica, but Jessica and her colleagues worked on this textbook to fit the needs of the population health course, community nursing. I know it has different names at different places, and it's meant to address the typical topics and objectives of that course, and to be used cohesively, across that course as a sole resource if you want to do it that way. The opens up all these possibilities, right? That you can use it in different ways, but you can, it was designed for that purpose. And as you've seen from the other textbooks, hopefully, pretty comprehensive, a lot of detail and thoroughness went into them. Just 2 more quick points, and I'll turn it over. I just want to mention that Sherry Roper was a co-author on this book. She really wanted to present it today. We couldn't make it work with the schedule, but we'll do follow-ups and we'll be able to have other opportunities to talk about the book. And then finally, we are doing this in partnership, sponsored by the Texas Higher Education Coordinating Board, and a place, we'll show this a little bit later, but there's the one summit, the one hub that you can go there, get all the previews for all the textbooks, join discussion groups to talk about the course, to share resources, to share ideas about how you're using the material, and so on. We'll show that link. We'll put that link in the chat, and we'll show that site in a bit, and then we'll share more on that. Thank you so much for posting that, Lindsay. Okay, with all that, sorry, a lot of preamble from me as usual, but thank you so much for joining. Jessica, thank you so much for joining us today. So eager to hear from you about the text. So take it away.
Okay. you so much for having me. And Sherry is wonderful, and so it's unfortunate she couldn't be here today. I know she really, from the get-go, had her own vision for this and really helped drive this project along with Susan and myself. So it was really great team effort. So I'm really fortunate that I was able to work with the three of them. So I was gonna share a few slides and just
Please do,
speak to
yeah.
them, if
Yep,
that
that's great.
works. Just give me 1 second. Okay.
That's
Okay.
great.
All right. I think you can see. Okay, here I am. So as Anthony mentioned, the book we're talking about is the Population Health Nursing textbook. And it was three of us, Sherry, Susan, and myself, that we had this vision of creating this open education resource that really prepares and engages students so that they can be meaningful leaders in their community and really focus on those population health nursing competencies. So when I think about just how it came together, a few key phrases and words came to mind, preparing, engaging, and inspiring meaningful change. So those are some of the initial, I guess that's what I had in terms of my vision when we started this project. So we wanted to really prepare nurses, right? And have a practical hands-on approach to population health nursing. And I find that in my experience teaching this course, and in the college where I work, Endicott, we call it community and population health nursing. And as Anthony mentioned, there's lots of different names for it. Some programs call it community health nursing, some call it community and public health nursing, population health nursing. But really to provide a hands-on approach for students and get them engaged in this content because they look at this course as, oh yeah, that's easy. I don't need to know that. I'm more concerned about working in the hospital. That's more important. And I'm not saying all students are that way, but a lot of the students I've worked with, they tend to focus more on the acute side and less on what it means to be a population health nurse. And so we really wanted to engage those students and prepare them. I love how these books have so many different resources, and one of them, unfolding case studies. I really feel like these unfolding case studies throughout the textbook really help prepare the students and put them in scenarios where they're like, oh, that makes sense. It really blends with what you're talking about in this chapter. Um, and then with the engaging piece, we have lots of interactive media boxes, podcasts, videos, case reflections, and I find that it's really engaging. Most of us here, if you're faculty, um, we've been challenged with really engaging students and keeping them, engaged with the material that we're talking about. And I'm very passionate about this topic, but the student may not be quite as passionate, so they're less engaged, right? And so this resource is excellent. And our vision was that we were gonna, keep the students interested and keep them reading and keep them thinking about the material. So throughout the chapters, there are lots of like little stops where they have a media box and they have something where they can watch a video or do an interactive activity, listen to a podcast, watch a video. And I feel like that really reinforces the content that we're talking about. And so I find that to be very engaging. And that was one of the things that we were really going for with it. And then lastly, inspiring that meaningful change. We do a lot in this book, but uncovering the roots of health inequities. And we focus on those drivers of health and health outcomes. And I really feel like this is helping us to get our students to understand the importance of improving health outcomes across the healthcare delivery continuum. So I wanted to bring up one of the chapters and just kind of show you some of these in the way where I'm talking about the boxes I'm talking about and the inspiring that change and the drivers of health. So I'm just going to bear with me. I linked it in. I think it works. So this is just an example of what it's going to look like. It's not final outcome yet. But here, one of the chapters on the social determinants of health, we have our economic stability. And we have this opportunity atlas, which is a great interactive tool for students that they can click on it. It's a web link, and they're able to trace the roots of today's affluence and poverty back to the neighborhoods where people grew up. So it's a really great interactive activity, and it goes right along with the content area that we're talking about, namely, economic stability and instability. And again, you
Jessica, I
go
just want
down.
to,
Yep.
sorry to interrupt. We didn't see the switch over. Um,
Oh,
sorry, I think we
no,
get
thank you for
exactly what you're
telling
talking
me
about.
that because
Yeah, yeah,
I'm
yeah.
talking here and um
Sorry.
why,
Just wanted to see if we
why?
actually, it might have switched browsers on you or something like that. So sorry.
No. Can you see it now?
Yes, definitely. Yep.
Okay. I'm sorry about that. Thank
No,
you
it's
for
fine.
letting me.
Happens all, you happens all the time.
So this is the economic stability. This is a chapter 8. And so this is one of those boxes I was talking about, the interactive box, and it labels it and tells you, what it is, where you can access it, and then some questions that really get students thinking about the content. You go down further, we have another interactive activity, and a lot of these media boxes and interactive websites that we're bringing students to really highlight the information. These are things that as faculty we've uncovered and we found, and we love to hold on to these types of activities because we know students like them, right? So this is a really great resource in that it's like a one-stop shopping. You got your textbook, you've got the information in your chapter, and then you have the interactivity there. This is another great one of a theory in action, this Harvard University project on moving to opportunities. And it just again highlights and reinforces how neighborhoods do make a difference in the health and well-being of its residents. So it introduces it again, gives you some questions that you can that really encourage students to reflect on it, and then some case reflections. So I just wanted to show that to you. Again, if I was to go to the next section on neighborhood and built environment, there's some great videos, some really wonderful questions that will help them think about the content that they're reading about and focusing on the role of the nurse. So I really like that. Let me just make sure I go back to where I was. I think I'm back to my slide deck.
Yep.
Okay, great. So our approach, again, it's very similar to what our vision is, as I mentioned in the vision, but we wanted to make this an accessible and engaging pop health nursing text. I think many of us in academia recognize that the cost of textbooks, resources is really a barrier for students. And we want our nursing students to be able to have the best resources and be able to afford them, right? And to really engage with the material that we want to teach them. So we really want it to be accessible, not only financially, but also accessible in that they can really understand it, break down the information, make it into something that really gets them to understand the foundation, the historical context, definitions, and then kind of build up from the bottom. Um, so we wanted to inspire students with some real world issues and, give them some ways to address them. I want to show you a couple of them if I could. So let me see if I can make this work. And again, I'm gonna have to do share, I think. Sorry, I'm talking out loud to myself. Okay. So some of the content, again, that we're thinking about engaging our students in some real world issues, things that are more contemporary, things that we are seeing in community and public health nursing. Racism. It's a big part of it, right? So racism and health inequities that result from that. So we have a chapter on structural racism and systemic inequities. And I think that's really unique, and I'll talk about it again, but I love this, right? So we talk about understanding the different forms of racism. And then even this here, right here, pops up a video, what is race? What is ethnicity? That's confusing for a lot of students. It's confusing for a lot of adults. So I think it's really wonderful. It kind of breaks it down and gives students a chance to really engage with it and understand it. So that's one of the content areas I think is excellent. It gives a historical context where we talk about, the segregation, it goes way back in history. Just giving some context here for where, our structural racism stems from, goes into redlining and that residential segregation. Um, why cities are still so segregated even today. And again, you'll see some videos on that, showing, reinforcing the information, giving them a chance to really understand how this relates, because we don't, sometimes we hear racism or we hear that, but we don't really relate that to health and health outcomes. And we really want our students to be inspired by it and really connect with the material. Again, mass incarceration, another concept that we don't often talk about in the context of healthcare. So I thought that was one of the ones I wanted to highlight with you. We talk about communities in crisis, whether it's, the opioid crisis, mental health crisis, human trafficking. And I think it's, again, these are topic areas that we're hearing more about, and students are, they want to learn more. They want to know what they can do. They want to know what their role is as the nurse. And so we're trying to, again, engage them with contemporary issues, and also offer some real world solutions. So that's one of the things I wanted to show you there. I want to go back. Okay. And our approach also, we wanted to really highlight the role of the nurse. There have been, I've been teaching, I've been in academia for, 12, 13 years. And I've reviewed so many different textbooks and books, especially for community and population health. And I often find that sometimes we lose sight of what the role of the nurse is. We get so caught up in talking about just the content that sometimes that important role of the nurse can get lost, and the students can get lost in that, and they can get overwhelmed. Like, well, what can I do about homelessness? It's too big of an issue. And so it can feel overwhelming sometimes, the content that we talk about. And so I think it's really good that this textbook, we wanted to really bring it back to the role of the nurse there. And throughout the textbook, thread the concept of health equity. We also decided that our approach would be to chunk that content, or, because community and population health nursing encompasses so much. We wanted to chunk it into 7 meaningful units. And, with all the OER resources, I think Anthony mentioned this before, each chapter is able to function independently of others. So, if this is a faculty member who wants to kind of pick and choose certain chapters, that's going to be okay. They can do that, and it will still work, and it will still educate and follow along with the curriculum for community and population health nursing. So I just briefly, to kind of give you an overview of the units. I'm not sure if I don't really know how much of this textbook you've seen an outline for, but the units, there's 7 of them, one of them being preserving the health of populations and communities, and that just lays a foundation. And one of the things I have to say I love about unit 1, it actually talks about the differences between community health nursing, public health nursing, and population health nursing, because as we've mentioned and as we've seen in practice, the terms tend to be used interchangeably. And so I think it's nice that we start small, and we just introduce just some of the differences and how they relate to one another, and thereby why they're used interchangeably often. Our unit 2 goes into the issues and challenges of population health. And this is going to focus on factors affecting access, delivery, quality of care. It's where we delve into those drivers of health outcomes, right? Our social determinants of health, structural racism, health disparities. Our unit 3 goes into our population-based practice and the tenets of public health. So where we talk about our socio-ecological perspectives, evidence-based decision-making, epidemiology, your communicable disease and infectious disease outbreaks. Our unit 4, merging public health principles with the nursing process. And again, I think this is something that makes it unique, because we often, we students learn about the nursing process usually in their fundamentals of nursing class, or somewhere, in the beginning of their nursing program. And then, they continue on with it through medical surgical nursing and maybe some acute care nursing. But when we get to community health nursing, it tends to again fall by the wayside because we think of the nursing process as applying to individuals only. And I love how this our book here in this unit, we merge the two together and we talk about it's, assessing the community is your client and really giving real world concrete examples of that. So I love that. Um, our unit 5 is devoted to culturally congruent care. And again, I think this makes it unique. It's excellent. We have a whole unit really devoted to culturally appropriate and responsive care and what that means. Not just one chapter, but we talk about cultural influences on health beliefs, transcultural nursing, culturally and linguistically responsive healthcare, and how to design culturally and linguistically appropriate programs. I mean, this unit covers so much important content that we often see overlooked in some other pop health textbooks. Our Unit 6 focuses on caring for populations and communities. And this is where we see a chapter on communities who are in crisis, but we also talk about communities who are affected by mental illness. Um, we talk about populations and care settings for vulnerable populations. And then lastly, our Unit 7 is the nurse's role as advocate and leader. And this is where we really kind of synthesize a lot of what we've been talking about throughout the textbook, but yet it still could be standalone, because it really challenges students to think critically about how they can use their position as the nurse to promote social justice and health equity. So I really like the 7 units. They're separate, but um, they all blend well together and lend content to each other, but yet you can still get some of that information from your standalone chapters. So unique features, and I hope I'm not talking too much. I apologize if I am.
No, it's great.
Again, I mentioned we have entire chapters devoted to some key concepts, and the two that I focus on are structural racism and social determinants of health. These are two of the chapters that I spent a lot of time authoring and revising and editing, and I wanted to make this so strong because we don't see this a lot. And it's so important for students to make that connection. And I feel like that's the only way we get to see our students become, change agents in the future when they graduate. So I think that makes it extremely unique and so powerful. As I mentioned, we have entire units devoted to our central tenets in pop health, merging those public health principles with the nursing process, providing culturally congruent care and what that means and what that looks like. And so again, students have more than just one chapter on transcultural nursing. They get to really learn what the class standards are, right? What that means, how they can be a change agent in their healthcare agency and implement those class standards, right? And then other unique features, that interactive platform. We have these roots of health and equities boxes that highlight, depending on which area we're talking about, where these inequities come from, right? We have theory and action. So, theory, we tend to hear the term theory and we get a little bit of students kind of they go to sleep a little bit on us, and I totally understand why. I probably was the same way when I was a student way back when. But the theory in action uses video clips and web links and other media to really demonstrate application of theory to that practice. So it really gives them something to understand and like something that they can hold on to versus reading it. And so I feel like that engages us students more. We have conversations about culture boxes, and these features focus on culture responsive nursing practice. And again, it's throughout the whole textbook. It's not just in that culturally congruent unit, right? So we have conversations about culture in a lot of different chapters. And with each conversation about culture box, we have critical thinking and reflection questions that really challenge students to analyze how they solve problems and consider alternative solutions, and critically appraise actions to understand, their own perceptions and beliefs and values. And then one of the other interactive things we have are client teaching guidelines. And this, again, this could be, it's a resource for students to use when they're out in the communities, right? So some guidelines that they can give to members of their community to teach them. And I think it's wonderful. And, throughout the chapters, when we talk about health promotion, primary, secondary, tertiary, we have a lot of tables and boxes and really break it down for the students so they can see the differences and know how to apply that at a community and population health level. So when I had to think about what I love most, I love our practical approach to it, that focus on the drivers of health outcomes and health equity. Um, Again, it's just that's where my heart lives. So that's my favorite part. Here, I have a hyperlink, so I'll just open this up and make sure. So this is under caring for populations and communities, and we have people who are caring for vulnerable populations and communities. In particular, this one's on people who are experiencing homelessness. And when we talk about the factors contributing to it, but we also talk about the intersectionality of individuals who are unhoused with the social determinants of health. Again, we make that link throughout. Those drivers of health outcomes are linked throughout the textbook. Um, and again, we have a lot of interactive um, features here to keep students engaged with it, and programs that we have that exist that really address these issues. So it's something where we do introduce um, a social problem, a social issue, but also things that are being done. And most of the time, nurses are highlighted. Nursing, we can do so much good. And when I show students and I give them examples, they can start to really wrap their heads around it and feel like they can make a difference. And that to me is just it's so powerful. We have a section on the health needs of veterans, and again, how that intersects with the social determinants of health. Similarly, with our LGBTQIA plus communities, health barriers, and addressing the health needs, and again, intersection with those social determinants. So it kind of follows along, but I wanted to just highlight that for you as I go back to my almost. Um, The other thing I have to say that I love most about this book as well, epidemiology. So I think in a past life, maybe I would have been an epidemiologist. I don't know, but I love epidemiology. And I think that the epidemiologic approaches, studies, and measures, the way that the textbook lays it out, we really try to make it accessible to students because, again, it's kind of content that can be difficult. And if it's really text heavy, with lots of words, it can be overwhelming. So I think that the way that it's broken down makes it so much more meaningful to students. So let me just share this and then I'll stop sharing in a moment. So this is where the chapter on epidemiology. So looking at types of study designs, again, gives you some words to read, some text, but some videos, and really kind of just tries to keep it very short and simple. Not simple like there's not enough information there. It's very informative, but trying to really drill down to what they need to know. And I love this theory in action because we have the Framingham Heart Study, right? And that really then takes the information they just read about the studies, right? And they can watch a video on it. And that helps it click in their head better. So again, just the way that it's synergistic to me. Some more theory in action, and looking at the epidemiologic measures, which for those of you who remember epidemiology, this, thinking about math sometimes makes us want to hide, right? Run and hide under the desk. But what I like about what we've done here is, again, trying to make it more accessible. I love all the emojis, by the way. They're making me so happy. we introduce what the definition of what something is, and then we have a box, how to calculate it with an example. And this textbook is really geared towards our undergraduate students. So some people feel, well, this is a lot of information. They don't need to know how to calculate all this math on their own. And I don't disagree. But what I like about it is when they can see how you calculate it out, then it actually makes sense what they're reading. And so that's why I think it's powerful to have the two of them go, the definition in the text and then the box where it gives you the example. And again, those two things together just reinforce the material, and it's very synergistic for the students to be able to understand how that works and why it's important for the public health nurse. So I wanted to show that. All right, I will go back one last time. And then lastly, some other things I love about this, we have so many extras in the appendices. So we have a list of, assessment tools that can be used. We have links to them. Lots of evidence-based resources. We talk about your community and public health nursing competencies from like the AACN, the ANA, the American Public Health Association, the Quad Council. So lots of there's the competencies and links to where they can find more information. We talk about, theories and models that have applicability to practice. So we give them a list of some theories, breaking it down for them into a table format. We didn't want to put all of that in the textbook because again, that can really be a little bit off-putting to students, but we wanted to make sure that they had that information available to them. So it gives them just more information should they choose to explore it further. And then we also highlight the AAN Edge Runners program. And the American Academy of Nursing really created this Edge Runners program to recognize the work, leadership, and contributions of nurses who are at the forefront of innovations in pop health. So again, it recognizes nurse design models of care that reduce cost, improve quality, promote health equity, and increase client satisfaction. So it lists these programs, and I think it's wonderful because we're highlighting the work of nurses, right? And what contributions and value they have. So I just think it's a really great addition to make the students understand that yes, we do have an important role to play, and this is a really great specialty to go into, a great area. Okay, and that's all I have to share. Should I stop sharing, Anthony? Is that better? Or
I think you can in case, and if we need to, if anybody wants to see anything in particular, we can, bring something back up, and stuff like that. Thank you. Jessica, that was so wonderful. Thank you so much. I hope you see from all the comments and emojis, they're all floating up.
I love the emojis.
so great. It was so great to hear about the breadth and the excitement around this book and just the detail that you went into, you and your colleagues in developing this and hearing like what really resonates to you and like I said, even when we were prepping, come on, sorry, I'll be polite. That like I think half the time, or even more than that, what faculty who join just want to hear from one of their peers, just talking about what's in the book and how you use it. Every book is different, every course is different, so just hearing about what resonates to you and why it's there, really, really helpful and important. So thank you so much.
Thank you.
We do have, and just everybody who's joined, thank you so much. We had, if anybody has any comments or questions specifically that you'd like either Jessica or anybody from OpenStax to address, please go ahead and put them in the chat or the Q&A, and we will we'll take a look and do the best we can. But again, that was great. And just one item I'll point out is Jessica's a hero because we have been showing the PDF in a lot of the other environments, and she was brave and showed the staging version of the textbook, and that's what the online version looks like. And I hope you all noticed it looks a little different from the PDF. That's the point, in that it It has a navigation. The boxes are all gray, and you might say, "Oh, wow, it looks like these gray boxes." Well, that makes it flow and makes it easier for people to use in different contexts and with different devices and so on, keeping it consistent. Reduce just having some of those simplicities of the features in the main text makes it load faster on a device if you're on a phone and stuff like that. So everything is there's different formats and different versions, and but as you saw, all the content is there in all the different formats. You can see the full sample up on the site right now, and colleagues have posted a few different links to that, so you can go grab it, and then we'll give you updates as well. Um, any comments or questions? We do have a question. Thanks so much. Does this text have a document that links everything to the new essentials? Jessica might not know that answer, because it might be an ancillary type of answer. But if you happen to know, go ahead, and if not, I'll do what I can.
So my impression is that we don't have an actual document linking everything to new essentials, but we do talk about the new essentials, and there is going to be an an appendix that refers, how it meets so yeah, not a full-on document that outlines step by step how it links everything to new essentials, but we do have a document that will speak to the new essentials and how the book addresses it. I feel like that's accurate. I hope I'm not misspeaking
No,
anything.
I think that's exactly right. Yep, and I will say that I think that's right. Again, I don't know what I've said in which session, so I apologize if this is a repeat, or I'm assuming I've said it and I haven't. So, but I will mention that we publish these textbooks, and they are meant, as we've said, to be sort of cohesive and usable. And I hope you saw today how much depth there is and how much quality there is in this book. And then especially the ancillaries that go around at mapping documents. We've talked many times today about mapping and mapping opportunities and so on. And starting off the day with a whole session on competency-based education. We know how things can transition in that way. As more people have ideas about what could be added, or if you start doing that work and you'd like to share and have other people sort of complete your sentence for you, that's where the community can really come in. If we really see like an opportunity to do that, or even, I'll put it this way, like a demand for it, we'll go ahead and work to build it, because we know how important it can be. And then it can go further. I'm not sure if anybody was on the session today with Denise and Cynthia, but they showed how they had, moved their courses over to their online learning environment. They were using D2L, but I'm sure you all use either D2L or Canvas or Moodle or Blackboard, and they were able to do some linkages there. And if the next step of that is linking it to the essentials and having each essentials competency somehow represented in the online learning environment, that's something we'd really love to dig into with you all on that. And that's where OpenStax can kind of help, and other instructional technologists and other folks can get together and work on that. So thank you, Andy, for sharing. It's a good one for Andy to share. Andy manages our UX team, and he makes all the stuff on the site appear the way it's supposed to, and interfaces with faculty to make sure that it's all designed well and is usable, and students too. So he might be integral in helping design some of that. Sorry. Other comments or questions? I'm sorry. I back. Any other comments or questions? What I'll do, maybe just briefly, I'll just let me make sure I have the right thing up on my screen before I go ahead and share. I'll just share a little bit about the navigation in case I don't know, some folks who have been to a number of these have seen this before. So sorry if it's a repeat. I'll be quick, but just I'll just share where to go. If it's not clear, I'll share this in a couple of contexts. So again, you saw the actual reading experience, which is outstanding when Jessica was sharing. But when it's time and you want to go to get to the resources and the links, you're probably seeing these in the chat. But if you go to OpenStax, you'll notice we're sending you links directly to the nursing page. But before we get there, just know that we have a very dedicated and professional and expert support team who can answer all your questions about, how to get the series, what formats is it environment, how do I incorporate this into my platform, I want to use it in Blackboard, all that sort of thing, and other things about availability notices. So the team will handle all those questions. You'll see the login. You do not need to log in to use an OpenStax book, students or instructor. It's all open for you to use. You can go ahead. There's no barriers to access. If you do want to get instructor assets, though, mapping documents like we're talking about, assessments, PowerPoints, and so on, you do have to log in, register, create an account, show that you're an instructor, and we'll give you access to that. Students are also encouraged to log in because that's how they can see or use highlighting and note taking. So that's the login feature. And then just to the nitty gritty, what we're talking about here. So we do have, if you drop down the subjects link and go to nursing, you'll get to the nursing books. And you'll see that we have the previews up for a few of those. And then we'll be adding more and moving into the final versions over the coming months. And just while you're here, just note that any other resources that you see on the OpenStax site, same sources, same licensing, same rules. So you can go to College Success, and these books have things on study skills and writing and preparing for college and choosing a career. You can go to the humanities section and get the writing guide, which talks about there's all things on presentations and so on if your students need that. Speaking of this course, it's a little bit tangential, but our anthropology textbooks has a lot on social inequality, and from, of course, an anthropological point of view. It's not a nursing textbook, but some of the material may overlap, might be providing some really interesting readings for your students. Again, not associated with nursing, no obligation to use it, but also the opportunity is there. And then, as I've mentioned, the hub, real quick. Yeah, so I went over here. This is, we've provided a link to this. This is where you can get the information about the summit itself, and we'll post some of the material coming out of the summit there. Previews of all the textbooks in the series, all 8. And then these groups that you can click on and join, and these get to be dozens and hundreds of people once books get published or they're advertised and promoted. This is about 2 days old, so 5 members is great. Well, we're assuming that's a lot from the conference, but those grow, and that's where you can post resources, share, have discussions with each other about materials, and and I'm sure the THCB team will share resources and information about this, about the resources, the texts, and the ancillaries that we find. This is where we'd be sharing, especially sort of Carla and Dawn's workbook on social determinants, and so on. All these things can be shared there to support teaching and learning in this course. So Sharon asked about clarify the safeguards in place. So we make an effort to make sure that anybody accessing those test banks and so on are faculty. We work with systems to make sure, and if you're not, I will say from the other direction, if you're not easily found on a faculty site at a page at a school website, like if there's not a faculty page at your school, or you're an adjunct and you don't have a school address or something like that, we can still verify you. It just takes a little extra. I will say that that's only the defense we have, right? If somebody finds our test bank and posts it to testbanks or exambanks.com, it's going to be there. We'll do all the takedown notices we can and get them down, but there are ways to put material up. So we really work with the community to try to safeguard that as much as possible. We don't share your information. Another thing about sharing, we don't share your information. We don't sell your email addresses or anything like that. We'll keep all that private. I'm just gonna look in the chat to see something else. So that was a whirlwind for me. Yes. But thank you. I'm gonna stop sharing. Any other questions or comments? I'm just so thrilled with the about this book. And there was just so much, we didn't really go through the process in depth in terms of how many steps we take, but I think everything in this book, just to consider, it wasn't just conceived and written by Jessica and her colleagues, but then reviewed by faculty, feedback, interpreted, debated. How are we going to handle this? I was just cringing. Like it's a quite a process. So I thank you for it, and we thank all those reviewers, but especially the authors and editors for taking all that in and responding to all that. It's a great effort, a great degree of humility, and then willingness to make changes and so on. So it's a really robust process. Um, well, thank you, Jessica. Anything else you'd like to share? Anything else you think we should talk about or?
I don't think so. I mean, I've been looking at the chat since I stopped talking, and it's great. And I think it's gonna be a great textbook to use. I can't wait to integrate it into my course, and I will be getting rid of my required textbook and just requiring this because it really does cover all of the essentials of what you need for community and population health nursing for the undergraduate student. So I'm thrilled and I can't wait, and I'm so excited. And you are totally correct in that the process was very, it's a labor of love for everyone, not just the authors, but the editors and the creative people and the reviewers. And so it was I think there's a lot of people who put a lot of their time and effort and love into it. So it's awesome. I'm very excited. I hope you guys are as excited too, because it's gonna be amazing.
That's so great. Thank you. Yeah, I mean, we see you'll see. I think Jessica, you're seeing this feedback and appreciation now. The thing that sometimes is even more. I don't know if it could be more rewarding than this, but when you see, and I think we're very privileged and fortunate OpenStax of having so much support from the TTCB and in part with them on this project, but then all the faculty from around the country. And when we see these books getting adopted, as many of them do, at hundreds of institutions with tens of thousands of students and knowing that impact. And I hope you all, it resonates. Almost everybody here at a school, there's OpenStax being used at your school because we're in almost every school in the country. And if not OpenStax, other OER. And so it's a really powerful movement that you're all a part of and can't wait to see it being used. So thank you so much.